Welcome to America This Week. United we stand. I'm Eric Bolling. As summer days drift away, America's fight against COVID-19 remains an uphill battle. This week, Dr. Deborah Birx said the nation is entering a new phase of the coronavirus. Concerns over back-to-school plans, economic recovery, and voting safety still remain. Joining me now to discuss this is the nation's doctor, U.S. Surgeon General, Vice Admiral Jerome Adams. General, thank you so much for joining me. I'm concerned about this, and I want to just go right to that Deborah Birx soundbite talking about a new phase. Help us out here. Take a listen.
But I want to be very clear. What we're seeing today is different from March and April. It is extraordinarily widespread. It's into the rural as equal urban areas.
So General, what do we do about this? This is a new phase. And by the way, will there be yet another phase after this one? It feels like it's coming in waves. Your thoughts?
Well, important for the American people to understand that we are making progress. I looked at the numbers right before I got on with you. Case counts on average nationally are trending downward. Positivity rate is trending downward, but this is a very different situation than what we were in March and April, where New York, New Jersey, the Northeast was particularly hard hit, and the rest of the country really didn't have as much of an experience with COVID-19. What we're seeing now is, while case numbers are going down on average, they're more widespread. And so people in the Midwest, people in the South and Southeast, people all over the nation are now seeing individuals get hospitalized and, unfortunately, some people dying from COVID-19. And that's why we really need to understand the 3 W's. Wash your hands, wear a face mask, and watch your distance are going to be what gets us out of this as a nation.
General, take a listen to, this is from Axios on HBO. John Swan, a friend of ours, spoke to President Trump kind of at length about COVID-19. Take a listen to this interchange. It's getting a lot of interest on both sides of the aisle. Listen.
They are dying. That's true. And it is what it is. But that doesn't mean we aren't doing everything we can. It's under control as much as you can control it. This is a horrible plague that beset us.
So, General, I think the question is, and President Trump is being judged, and he may even be elected or not based on the coronavirus response. He said right there, we're doing everything we can. Care to comment on that? Are we?
Well, one of the things I want the American people to understand is that case counts are going down. Many people are doing the right thing, but case counts are what you see before you see hospitalizations go down. So you do the public health measures, 2 to 3 weeks, you see case counts start to go down, another 2 to 3 weeks before you see hospitalizations go down, and another 2 to 3 weeks before you see deaths go down. So one of the challenges is people out there seeing hospitalizations still going up in many regions. They're seeing, unfortunately, people passing away in far too many regions, but that doesn't mean that we aren't making progress and that we aren't doing the right things. I want the people of America to understand you're doing a good job. Keep at it. Let's normalize that positive behavior. Let's help everyone understand that this is one of the most powerful tools we have for a safe and a sustained reopening.
General, I'm always in favor. By the way, I've been wearing a mask on airplanes for the better part of 2 years. I'm with you on that, sir. Tell us a little bit about voting in person. Come November, or 120, 130 million people may come out to vote. Is it safe to do it in person?
Well, especially as an African-American man, I very much respect and value everyone's right to vote, and we need to do everything we can to make sure people can vote and that they can do it safely. And I know I sound like a broken record here, Eric, but when you look at Italy, when you look at Spain, when you look at even New York City, these are the hardest hit places in the world, and within a matter of weeks, they were able to turn around some very, very terrible looking numbers. So when you look at November, I actually have a lot of confidence that most places around the country can vote in person in November if we do the things that we know now will help control the spread. Wear a mask, watch your distance, which means stay at least 6 feet from other people and avoid crowded indoor spaces, and wash your hands. If we do that, we can vote.
General, do you think we need maybe some sort of staggered voting? Because, as you point out, keep your distance or watch your distance is one of the 3 W's. I've been involved and I've seen lines to vote in normal times down the block and left and right. And if you add 6 feet distance to that, Will people just give up and not vote? My question is, should we stagger maybe odd even days or odd even hours for your address, or you know, by your last name? Should we stagger the times you can vote just to keep this a safe voting process?
Well, again, I want to vote, and I would prefer to vote in person, but that's going to depend on community spread. I think we need to bring federal, state, and local individuals. And remember, voting is actually done at the local level together to figure out what things we can do to get people in and out of the voting booth safely if they choose to vote in person. But you can have the best plan in the world, and it will face challenges if you have runaway spread in the community. You can get away with a less than stellar plan if you have no viral spread in the community. So it comes back to us exercising our personal responsibility, doing the things that we know are effective to slow the spread of this disease. And know that on a federal level, we will be making sure we continue to send support to those places that have been hardest hit so that they can test, so that they can isolate, so they can contact trace, so that they can treat this disease. And we're in a much better place for treatment. Mortality rates are down. Yep. We are making progress. We need to prevent. The final point I'd make is that people need to go to coronavirus.gov or go to their State Department of Health website, trusted resources, because we've got a pandemic of misinformation just as we have a pandemic of virus. But armed with the facts, we can vote, we can open schools, we can get back to worship, we can get back to some sense of normal while we wait a vaccine, which we are expecting now by the end of the year or early next year.
Surgeon General Jerome Adams, thank you so much for your time again.
Thank you, Eric. Always appreciate it.
Thank you.